Hi, it's a beautiful winter day in Michigan, and I was going to do a Moxa video today. Moxa is burning herb, and a lot of times we will heat up acupuncture points or areas of the body, and instead of and in addition to doing acupuncture. So I was going to cover a few things today and some cautions about doing moxa that you might be able to use it a little bit at home with yourself and your families, and maybe he'll be able to help somebody. Now, remember, this is very, very hot. I haven't lit it yet, but it'll be just like a hot timber there. So like a cigar or something. And so you have to be very, very careful. And don't set it down in an ashtray. It will heat right through and burn the furniture right under the ashtray. So I have a little tray here, and you can get all of these on Google. I'm going to give you a piece of paper here that will append to the video here in a little while. It'll give you some cautions, and it'll give you the brand of moxa stick that you might like to get, and some pictures of the extinguisher tray. This is a wonderful thing to have if you're going to do moxa. Otherwise, you're liable to burn the house down. Okay. Now, this stuff is really hard to light. You can do it with a propane lighter, but it's pretty hard. And matches, forget it. I was hunting for my torch, and I can't find it right now, and I didn't want to waste any more time, so I'll have to run upstairs and just light it on the stove. That works pretty good too. So I have here some notes that I'm going to put on the video later, and it'll tell you points that are prohibited for Moxibustion, okay? And then it says, when should you not use Moxibustion? If you're pregnant, if you have an allergy to mugwort, which is the herb we're using, or smoke, you don't do it on skin eruptions, abrasions, and inflamed areas around the eye, and be really careful on the face if you're going to do it on the face. Don't do any point work on the face. You can gently sweep and warm some areas on the face, and I'll show you how to do that a little bit, okay? Then on this paper here, it also shows you where to go on your Google to pull up acupuncture charts that'll show you the meridians and the points, and another little section that'll tell you the anatomical location of the points. So that's all on here. Plus the type of moxa that we want you to use as well. There's lots of them out there, and you can choose, but I like to use the smokeless because in the clinic I can't have a lot of smoke going on. So I'm going to go ahead and do some moxa. There are 5 forbidden points, but these are forbidden for acupuncture too if you have a pregnant lady, because it could possibly stimulate a strong reaction and maybe abort the pregnancy. So you got to be very careful with that. So just don't use moxa with a pregnant lady, period. Or acupressure. You got to be real careful with that too. Okay? So I'm going to go ahead and I'm going to go ahead upstairs, and I'm going to get this thing fired up, and let's get to work and show you how to use some of this stuff. Okay? I'll be right back. Now, this is the moxa stick right here, and it's lit, so it's really hot. And rather than just explain it all first, I'm going to do some moxa and just show you how I do it. And I do it counting so that we can get the right amount of moxa to do a good job yet not burn the person. We don't want to heat too fast the surface. We want to heat a little bit slower so that it will penetrate and do the job we want it to do. So what I do is, now this point here, here's the knot, and a knot on the knee there, right below the kneecap, there's a knot. And you go over just below the knot and go over right over here a finger's width, and that's the point right there. So what we would do is I would go to that point, and I would just gently start to heat it. I'm about an inch away from the skin. And Shelby, who has volunteered for this, she's going to tell me when it's hot, and then I'll move my hand like that and count 3 seconds. So let's go ahead and do this and see. It might take a tiny bit in the beginning to start heating up, so we'll heat it slow. And Shelby, you tell me, just say okay or something, okay? Mm-hmm. Good. And what we want to do is we want to keep doing this until 1001, 1002, 1003. Then we go back and heat it again.
Okay.
1001, 1002, 1003. 1001, 1002,
okay.
1003. 1001, 1002, 1003. 1001, 1002, 1003. Okay. We're still at 3. 1001, 1002, 1003. We're trying to go down to 1. 1001, 1002, okay. 1001, 1002, 1003. 1001, 1002, okay. 1001, 1002, 1003. 1001, 1002. Okay. See, we're right at there. 1, 2. That's where we want to be, okay? So that will work right there for what we want to do. There's another point on the big toe, right over here. Can you get that, Mike? Yeah. Okay. You go where the nail and the crease is here. Okay. On the outside, between the nail and this crease. And you just heat that gently. So I always get a steady rest so that I don't have my arm going like this, okay? So I'm going to rest my hand here, and I'll go in here and heat this point gently. Tell me when to stop. Now, this point is wonderful to stop bleeding. This could help with menorrhagia or too much menstrual bleeding. It could help with somebody cutting their bleeding a lot. Sometimes people have blood in the stool, things like that. Well, this point right here between the corner of the nail and the first line there, that's a good place. It's spleen 1. This one up at the knee is stomach 36. And you'll be able to look that up on the chart that I'm gonna show you how to get to that chart. How we doing, Shelby?
My meter's still cold.
Now this happens sometimes. Okay, 1001.
No, it's still
okay. This happens sometimes. I was doing a gentleman who had arthritis in the toe, in that big knuckle here, and he would get worse with cold. So I didn't want to put a cold needle in there. So I got some Moxa and I started moxing that joint. And I swear I was on that thing for 5 minutes. And it would just soak it up the heat. It was just really awesome. And Shelby tends to have a little bit of cold feet here. So we'll do this. Still nice and warm? Okay, so if she was to say okay, I would move my hand and I would count to 3 seconds. Then I'd go back to the same level and I would just heat it. When it starts to be closer and closer together, that the person tells you that it's hot, okay, you keep doing it until it's about 1 or 2 seconds, and then they say it's hot, and then that's when you're done. So at first you might be 15, 20, 30 seconds, or like you can see here, even more. Just take your time. Don't try to heat it too fast, because some points will take in more heat. You saw how fast we heated up here at the knee, and I was about the same distance away. So anyway, I'm not going to continue to heat up this point. We're not treating Shelby for this at this type of thing at this point in time. So just to facilitate time, we'll just go forward. Now, right at the side here, here's the knuckle, the big knuckle right here. if you'll slide over the knuckle, there's right on this side of the knuckle, there's a, it indentates there right there, okay? That is a point that you could heat up. It's on the spleen channel again. It's spleen 3, and you can heat that up, and you can do that. It might help for digestion. It could help for sugar cravings. I do an acupuncture on this point, but you could do Mox and stimulate the point. The little tiny sting that the person gets when they tell you that it's hot, that is very similar to the pinprick of the acupuncture needle. So it stimulates a similar cascade of events, neurological as well as energetic and neurological as well as fluid and blood. So then that's what we're trying to do to get the effects with acupuncture. So as you can see, it's there it got hot. Okay, 1001, 1002, 1003.
Okay.
1001, 1002, 1003.
Okay.
1001, 1002, 1003.
Okay.
1001, 1002, 1003.
Okay.
Okay, now you can knock the ashes off, but do remember that now that it's going to be hotter because you just knocked the ashes off. So maybe start a little bit further away.
Okay.
1001, 1002, 1003.
Okay.
1001, 1002, 1003. 1001, 1002,
Okay.
1001, 1002, 1003. 1001, 1000. Okay, you see? We got down to 1.5, so I'm done. So a little bit for sugar cravings, help with digestion here between the knuckle and the corner of the toe. You can heat that up, and that would be awesome for bleeding. Yeah, bleeding. Okay, this one up here that we did, stomach 36. You got it, Mike? Oh, okay. So stomach 36 right here, wonderful for the stomach. So it'll help us adjust the stomach, good for digestion. It's the master immune point in the body, and it's an influential point for all muscle in the body. Very energetic point, wonderful point for that, okay? So that's a few things. And in your charts, when you look up the points, it may or may not say that Moxa is applicable, but I'm going to give you a chart that is going a chart that'll tell you which points not to use and where to go to look for the location of these points. Okay. Now I'm going to have Shelby turn over. Okay, Hunt, turn over for me, and I can put this under your ankles here. There we go. Okay. Now, can you get me over here, Mike? Okay. Now, this one here, I've had a lot of success with. If people are cold, their hands and feet are cold all the time, a good one to heat up would be between the ankle bone and the tendon here, and you could just heat that soft spot up right there. That's on the kidney channel, and the kidney in Chinese medicine is the fire and the water of the body, or the yin and the yang. Yang is sunshine, it's day, it's male principle, it's fast, hot, exercise, working out, playing. Yin is nighttime, cool, calm, restful, female principle. It's the moon, it's cooling, it's the earth rather than the heavens. So you can heat that up there. Okay. Another one, if somebody, it tends to be more cold than other people, they're wearing sweatshirts when other people are in t-shirts. Right here at the when point your toes, you see the little indentation there. It's just like when you treat your hand like that, right past this knuckle. There's a hole right there, and you could treat that one too. Heat that one too. That's kidney 1. That's where we ground out at the earth with the energetic system. So you could heat that point, kidney 1. Okay. Now, one treatment that I use, and it's for prolapses. So prolapse rectum, prolapse uterus, varicosities, hemorrhoids, that type of thing. And this one works really well. And in addition to that, I would use some herbs. Yeah, I'd use some herbs. They call it arouse vigor. It is okay. It's okay. You don't have to get a picture of that, but we use herbs that help raise the center. And you can go to our website, and which we'll probably put on here, and you can get this from our web store. But it helps to raise things up that are prolapsing. Now, what you do on this one, it's very simple. You just slide up the leg and you go into a hole here. You know where this muscle splits right here? That's where you're going to go, right in that hole. And since you're using Moxa, you don't have to be as precise as I do with a needle, but if you go like that, you're just going to go into a hole. And you would do both sides. So what you do is you'd heat that up. Okay, so same way, I just heat it until it's got too hot, and then I would count to 3. Well, once again, we're not going to stand here and heat all these points up to the end of the heating. But yeah, I just want you to get the idea. If she said that that's hot, I'm going to do this. And I'm going to count to 3. 1001, 1002, 1003, and I'm going to heat it up again. And we're going to keep doing that until the frequency gets really close to 1 second, 1 or 2 seconds, and then we're done. So you want to heat it up to that 1 or 2 seconds, but heat it slowly enough, okay? Otherwise, you're not going to get much benefit, okay? Now, with the hemorrhoids, if that's something you want to do, and possibly any prolapse in the lower area here, you could possibly do some moxa below the tailbone. Okay, you just feel the tailbone here like this, and you may have to spread the cheeks a little bit. Head moxa. Be careful. Obviously, tender tissue, it might hurt, but if you could, you don't have to, but if you can add that point, that would probably add to the efficacy of your treatment. Now, I'm going to show you the next point that I do that is very important for the prolapses. I've used this with a prolapse rectum. It looked like a grapefruit, and I had it retracted in 4 days with these herbs and the moxa every day. Hun, would you turn around so your head's at this end? Let me get that. Yeah. Okay. Put this under your knees. There we go. Okay, now what we're going to do here is, well, I can't do it with this little bun here. Okay, what you do is you go to the tip of the ears. Here's the tip of the ear. Don't hit that, son. And the tip of the ear. Okay, so you go straight to the top between the tip of the ears, right in the middle, lined up with the nose. Okay, and you would just split the hair apart and put some clippies in there or something. I might use something like this, um, one of these things, and just get it here and to get it out of the way. Or you can wet it a little bit and move it to the side, whatever you want to do. Okay, and that will help raise the energy to the top and pull up. That's what you're trying to do to get rid of the things that are falling. So once again, you would just go like this and do the same exact thing. Heat it. She says it's hot. You go 1001, 1002, 1003. You come back and heat it until you're done to 2 seconds. Okay. So you go to the tip of the ears. You come over the top from one to the other, you draw a line, and then right on the midline. And where they cross, right at the crown there, that is what you're going to heat up. So if you do that with the back of the leg that I told you, go into that hole on the back of the calf, boy, that would be wonderful. And especially if you get a hold of some of those herbs, arouse vigor, that's going to really help you out. So that'll do it, honey. Thanks. There are, well, you know what? I could go ahead and show you another one here. Can I get to your tummy? Okay, so if you take the person's fingers, not your own, well, it depends. I have big fingers and Shelby doesn't. So her fingers are her body inches. So when she puts her 4 fingers together, there's 3 body inches. So we want to subtract 1, and we want to go 3 fingers. So we go 3 fingers down from the middle of the navel. So she would go like this, 3 fingers down right here, okay? And then heat that. Can you see that, Mike? Mm-hmm. Yeah? Okay, and heat that gently. Okay, now that is a major point for the energy. This is where life began, hook to mom. So a very energetic point. You can heat that gently. Matter of fact, we used to take a paper towel roll and put it over the daver and put salt in it, and then we'd put a piece, or we could put a piece of ginger. Put a piece of ginger on it and then put some moxa pieces on there and light them with an incense. But don't mess with that. But I'm just saying it's safe to do this down here. But you don't want to heat down here, especially when there's pregnancy, okay? And don't use moxa. If somebody's pregnant, just don't do it, okay? So that's another point for energy. So the one on the side of the leg and the one here, wonderful for energy. Now, one other thing while I've got Shelby here, with her on her back. Will you take off your glasses, honey? Now, you might want to try this, but be very, very careful. I can't stress how hot this thing is. Okay? And so when somebody has Bell's palsy and their face is drooping, in Chinese medicine, we call that wind in the channels, wind cold attack, and it's obstructing the channels. So what we do, and the sooner that you approach this for treatment, the better. You wait weeks, it's going to be harder to fix. So if you know yourself or your family or a friend that you woke up in the morning and they're like they have a stroke or something and it's Bell's palsy, then you can try this. And what you do is you're not going to do any point work on the face, please. What you're going to do is gently heat the area. So what you would do is, can you turn your face a little bit that way? Let's say, for instance, it was on her right side that was affected. Now, there's channels that cross coming up to the face and going down the face and going over the head. So the area that's most affected is usually around the mouth here and the side of the nose and under the eye here like this and the jawline. So what I'm doing here, see, it doesn't matter if you're following the channel. There's lots of channels on the face here. And what I'm doing is just gently warming this area, okay? And sometimes it gets up to above the eyebrow too. You notice I'm not stopping. I'm just gently warming the area, okay? And you can keep doing that until the skin looks a little bit rosy, okay? And that will be sufficient. So a lot of times they have trouble closing their eyes and stuff like that, and certainly it shows up around their lip droops and things like that. So just be so gentle and careful here, and make sure you keep the ashes off, because they'll fall on the face. So again, you have to be very careful. Now, when you knock the ashes off, it's going to be hotter, so be careful, okay? You don't have to hurry this process. Just gently do it. And the sooner you do this, when you see that you have Bell palsy or your friend or family, the sooner you do it, the better result you will have. Now, this is starting to get a little tiny bit rosy here. Not too much, but we don't have to overdo it. We don't want to get hot to the point that it's uncomfortable for Shelby. We just want it to be comfortable. So that's what we would do there. Also, you could do that same technique for, let's say somebody has tennis elbow, okay? Well, all we're trying to do is move blood and energy, because pain and malfunction is due to a congestion of energy and fluids. So as I heat gently like this, I can heat this area. Don't do point work necessarily, okay? But heat the area like this, okay? You can do the same thing in the knee. You can do the same thing in the low back. Don't do any point work. Just move the Moxa stick over the skin, whatever area you want to do, and don't do any point work. Just gently warm up the area, okay? And that could possibly make people more comfortable without incense or something. You know, you don't know. If you do it gentle, you can go ahead and try and see. So we covered quite a bit there. Energy at the knee here, at the side of the knee and on the navel, really good energy. Across the low back, behind the navel. Go behind the navel, and that's Ming Men or Life Gate. And that'll take up some energy there and be very energetic. Now, that point there behind the navel, there on the back, if you go straight across like that, you're heating the kidney, which is very, very important, and that could help with incontinence. It could help with anything with the kidney, okay? I've even used that for people who are on dialysis, and they get really weak and things like that, and we use it just to strengthen them. So once again, if you're going to be doing this, please get here we go. Please get one of these little trays or something like it and put this in here. Now, I used to put a shot glass in a big ashtray, big glass ashtray. It filled with salt, and I would just go boom and leave it, and that always worked. But one day, it didn't work. And I left it thinking it would. It broke the shot glass. It actually broke the big, heavy ashtray. It melted the propane lighter beside it and never caused a fire. Praise the Lord. It would have burned down my house. Anyway, that's what I'm telling you. You must be careful, because you're messing with fire here, okay? So I hope this has been enjoyable and helpful for you. And please comment, like, okay, and all that kind of stuff. Subscribe to the channel, and I will be covering some other stuff, quite a bit of stuff, as a matter of fact. And my son is going to help me get on Instagram. So I'm at Acupuncture Info for you too. The number 4 in the letter U and the number 2. So it's acupunctureinfo4you2.com. And so that's my website, and we have a web store there as well. And some of my other videos, I'll describe some of the nutrients and the tonics and things that we use. And you can get those at the store as well. So thank you very much. I hope you learned something. If you need to have any questions, please put it in the comments. I'll try to answer your questions. And if enough of you want to see more stuff about this, heck, I'll just do another one and go over some other points again if you so choose. It doesn't matter to me. I'm here to teach you. Okay? So, bye for now.